to the very first episode of Vet Insights podcast. My name is Fira and I'm the conference producer for the Singapore Vet Show 2024 and I'll be alongside with you for the next 10 episodes. Now, this podcast is really meant to be an initiative to discuss everything and anything related to the veterinary world. And of course, because I am no means an expert, I do have someone here with me to be my guiding guide. And with that, I would like to introduce everyone to Dr. Ilyas Hanafi Razali.
Hello, everyone. Dr. Ilyas here.
Would you like to introduce
Oh,
yourself?
okay.
What are you doing right now currently?
Before that, how are you doing, Fira? Is everything okay there?
Yes, I'm good. We have just finished, I think, about 15 minutes trying to figure out the audio settings. So I hope everything will go well for us.
Yeah, sure. For everyone for everyone who's listening right now in YouTube or maybe in Spotify, Apple Podcasts, and whatnot, I'm Dr. Ilyas Hanafi Razali. I hail from Malaysia. Right now, I'm practicing full time in poultry medicine, poultry farming. So basically, I am a chicken doctor. But on my side, I do locum. So basically, I am in touch of every animal that you can think of. For locum, I basically focus on cats and dogs, basic medicine, basic surgery, basic treatment. And on another side of my job, on my side job is I am also the administrator for Malaysian Veterinary Locum community, which we have around 800 plus doctors in the Facebook group. And we have locum vacancy every now and then. So basically, that's what I do. I graduated in Malaysia in 2020. Right now is my fourth year practicing and mingling with animals.
So have you been like, a locum or like ad hoc vet since you graduated, or have you done full time for a couple of months or years before you proceeded to what you're doing currently?
Okay, back then in 2020, actually I practiced small animals for 2 months in Johor Bahru. So full-time vet in small animal clinic. It's a new clinic and we practice mostly cats, but sometimes we do get exotics pets. So for the first 2 months of my practice, I do practice small animal, but after that, I move on to locum veterinarian. I do ad hoc calls. For example, if any clinics needed extra doctors on the weekend, if there is any doctors on leave. So I'll be the replacement doctor on that day.
So I have a lot more questions for you, but we'll reserve that for later because right now we since this episode, we're actually looking to discuss on locum versus full time. So there's always like two sides of the coin, and we're here actually to discuss the pros and cons for each side. So first question I just wanted to ask, the aspects of the appeal of working either a locum or full time. What's your opinion about that?
Um, First and foremost, I think at the end of the day, even if you are not a vet, it's what you want. For example, if you already in this field, you will know that. I think in any field also, you will know that this job will consume your time. Being a vet, most of the time, 1 week you will have only 1 day off. So if you are okay with that and you are willing to practice and seeing, clients every single day and comes in to treat cats and dogs and whatnot, if you are happy with that, that's okay. Some of the people who opt for locum, they really wanted to have that flexibility of time, flexibility of being not in control. Because why? Locum basically is a freelance job because you don't have any boss. You are the boss. But during that day, if you are doing locum, then you have that boss on that day lah. But basically, you decide your own schedule, you decide your own time, you decide where you want to go and whatnot. If you are doing full time, yes, you are staying in one clinic and you are doing full time. You are bound to the rules. But locum, you are bound to the rules, but not all the time. The flexibility on locum side is there. But again, when we talk about pros and cons, definitely if you are full time, you gain trust.
Yeah.
Being a doctor is not about flexibility. At the end of the day, it's trust. People wanted to trust you. Your clients wanted to trust you. You want to build a client base. If you are an artist, you have fan base, and then doctors have client base. So choose what you want. If you want flexibility, then you go for locum. But if you want trust from the customer, you want client base, you want people to trust you because at the end of the day, you have another goal. For example, opening a new clinic, then you can stay in a full time clinic. But in doctors, it's not odd for a doctor to do full time and also locum. So if he or she like that kind of work, then there will be no holiday. But if she really, if he or she really care about skills and also experience and connection, then they will do full time. So locum vet.
Yeah, I think it also, depends on individuals, the kind of life that they want to live out. I think personally, I've always thought that, working ad hoc basis or on my own schedule would be really interesting, like what you say, you can be your own boss. But at the same time, I think the stability of it is what scares me. And that's something that I want to ask for the next question, how do you determine the stability of your career when you are doing locum?
Oh, definitely, there's not
Because
much stability.
yes, because for full time, you are guaranteed, this is your pay, this is what you do for the month, and then it repeats for the next 12 months, depends how long you're in the clinic. But for locum, how do you ensure that the stability is there?
I want our listeners to understand when it comes to stability, it's not about salary at all. You know, I mean,
Mm.
if you are a full time vet,
So it's
definitely
passion driven.
there's definitely a lot of benefits. For example, retirement plan, and then health insurance that have been provided by the clinics, and also trust and everything. So you have that kind of strong base if you are in a full time vet. If you are a full time vet in a clinic, but with locum, one thing that you are missing is responsibility, because responsibility build trust, right? So if you are doing freelance work, you do doctor there, doctor here, you might have a lot of experience. You might have much wider connection. But the responsibility that you bear, for example, I give you one example. A full-time vet can accept a cat and then put the cat in ward. And then he or she, the doctor, will be responsible from A to Z, from the first admission up until they discharge from the clinic. But for local vets, for example, I do locum on Saturday, for example, and then I accept cats. I wanted the cats because that cat needs more attention. But the day after, tomorrow, will I be discharged the cat? Then another doctor will have to replace me, and we might not have the same understanding. Might not have the same base to discharge the cat and give advice to the owner. So, for
Mm.
stability wise, I don't think locum have that stability. But if you want to if you want to have stability, then go for full time. You have salary increment, you have
I see.
trust, you have responsibilities, and then you can gain a lot more because most of the time, all the owners of the clinic will provide you CPDs, and then they will send you for seminars and whatnot. But for locum vets, you have to pay for your own seminar, and seminar is not cheap. Seminar quite cost you a lot of money. So for locum vet, stability is not there. But as we discuss, maybe we will discuss along the way. But as you say, Fira, what you want in your life? Flexibility,
Correct.
or you want stability?
Yeah, I think also, if you were to have already been in the business for long, in the full time, you probably have grown a client base that affords you to be a locum doctor, because these clients will be coming to you specifically asking for you. So you don't need to be tied down to a clinic in a sense. So that way, you can just work at your own time since you know that there are already clients who is willing to pay for your service. I think one of the things you mentioned also, being your own boss. So, how do you prioritize work-life balance in your veterinary career? I think it's like you mentioned, full time. You're working long hours. Sometimes there's emergency calls. So how do you ensure? I'm pretty sure on my example would be like as the locum, there's more stability there in terms of your work-life balance. But for full time, how do they manage that?
Okay, I give you two examples because I have friends that work locum full time. I mean, like, how do I say? It's very oxymoronic, but it's a locum vet, but fully locum. Okay, fully freelance doctors, and
Okay,
another
right.
friend is full time vet. How do I see them having work life balance? First thing first, let's talk about the full time vets. I live nearby with the full time vet. He is my very best friend, and we go to the gym together. We do activity together. The only thing that holding him back is he has only one day off along the week. For 7 days. Only one day off, and then he ends his shift around, I think, 6:30 or 7 p.m. That's almost late. Some clinic do finish at 9 p.m. That, but he's finishing at 6:30 or 7 p.m. like that, and he have one day on call for 24 hours call. So I see him. The only way that he is having work life balance is he is willing to sacrifice something. For example, work life balance doesn't mean you have rest. Work life balance means that you can go anywhere you want. You can spend whatever you want to eat, what you want to eat or you want to drink, and then having a good body. For example, going to the gym. So to have that work life balance is actually he is willing to sacrifice. So there's no chance of work life balance if you see on one side. But for him, as long as he can buy coffee bean early in the morning, having a good lunch in the afternoon, and then going to the gym in the evening, that is his work life balance. So he is happy.
Okay.
So every stress, just leave at the clinic, and then after that, the end of the shift, going to go to the gym, just blast the weights off and whatnot. So on one side, we can see, okay, I can see you are having a work-life balance, but in your perspective, maybe for you or maybe for everyone who is listening, you cannot see how can you have a work-life balance when you end your shift at 7 p.m., you come in at 9 a.m., and then you have only one day off. How about your, official government government thing that you have to settle down and whatnot? But for him, that is work-life balance. On the other side of the story, I have a friend who is doing locum all the time. How is she having work-life balance? Is by doing 2 weeks locum and 2 weeks off. You might see there is work-life balance, but can you work 2 weeks without holiday? You might have to think, because I don't think I can work 2 weeks straight away. 14 days straight working is very, 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 very hard for me to do. So, for me, work-life balance as a vet, you have to put it not the priority, but you have to achieve it at the end of the day. It depends on you how you define work and life balance. If you think having rest, having 2 days rest, having to end your shift earlier is your work life balance, then you have to find that way. For example, locum, you don't have to work all the time. You can choose what day, but again, you have to lose some. You are willing to lose some. For example, you might have work life balance, but you might not have the money. But if you want money, then you might have to sacrifice something. So it depends.
Yeah.
Work life balance for me,
Yeah.
as far as 4 years this veterinary thing is going, I don't think there's a good definition of work life balance, but there's a good definition of happiness. There's a good definition of satisfaction. If you think that you can work with one day off, but you are satisfied because you can see your cat is healing, your dog is healing, and everything, satisfaction is number one. But if you think that, okay, I want to rest for the 2 weeks, and then I just have to work another 2 full weeks and then rest again and keep the cycle on, if that is your satisfaction, please go for it. Please go for it. Money at the end of the day, you can find. You are a doctor, so you choose your way.
Yeah, I think that's a very nice way to put it. That at the end of the day, it's a satisfaction that you feel, do you get that sense of gratification from the job that you do? So at the end of the day, it boils down to what exactly does work-life balance mean for you, Like to some people, I may be working 70% of the day and then like the other 30% is doing my own things. And I am happy with that balance. It doesn't necessarily have to be a 50-50 balance to which other people perceive it to be, as long as you're good with it.
Yeah, but Fira, I mean, like for you and for us, we have worked for
Mm.
quite some time, and then
Yeah.
I'm trying to make sure that our listener understand work-life balance. Like you say, I like your words. It's not 50-50. It's like what you satisfied. If you are satisfied with 70% of your time is doing work, then you are satisfied. Then okay, that's fine for you. I like your words. It's not 50-50 at the end.
Correct, because that 50-50 depends on each individual. So if to other people you want to have 50-50, by all means, but to some, it may even be 80-20, depends on the goals that they want to achieve in life. And I think for vets, you get that gratification, seeing your patients, your cats and dogs, rabbits maybe, how they recover as they get better from their sickness and such. So, that is the satisfaction that you get.
Exactly.
So next question, in terms of professional growth, in a full-time job, you are guaranteed like, you climb up your way up the stairs, A, B, C, D. But for locum, because you're here, you're there, you're everywhere, how do you ensure that, you are able to grow in terms of your career? Can a locum practice provide that as compared to a full-time?
Okay. For a full-time vet, I want everyone to understand that if you are bound to a clinic, you have contract or whatnot, they will provide you continuous education. They will pay for it. For vets, we have to collect CPD points, and it is important for the owner of the clinics to pay. And as what Fira said, there is a very clear cut that working full-time vet, you can climb the ladder. For example, salary increment, you might become a manager of another branch, you will go to seminar, this and that, you might become, you might be sent outside to teach another clinic. That's what is trending in Malaysia, sending doctors to teach other people. And for locum vet, if for me personally, if you see on one side, you might have the flexibility. But again, coming back to the word stability, you might not have that. In example is climbing the ladder of your work, how to grow if you are only a locum vet. But at the end of the day, you might see that a locum vet has very wide connection, and they are not bound to one boss, and they are not bound to a group of clients who are familiar with that clinic. And that kind of connection, the widen of connection for the locum vet is also very important, because at the end of the day, I believe small animal doctors, they will not work for someone for a long time. The goal is to open on their clinic, whether or not you are a full-time vet or a locum vet. But full-time vet, as I say, we have clear cut. But for locum, one thing you can take from my message is, if you have that flexibility, you can find money. Listen, if you are doing locum at one point of time, and then you have your own experience, you have your own knowledge, you can ask for more. For example, in Malaysia, standard price per day is about 300 to 400. Standard price for locum 300 to 400. But you will not stay there for quite a long time, because in full-time vet, you can see salary increment year by year or bi-annually or whatnot. But for locum vets, that's the only way. You have to negotiate your price, because you have knowledge, you have skill that you can offer to make sure the clinic has higher turnover rate for the clients. That's the first thing. Second thing is, please separate some of your money. Please keep some of your money and go for good seminars. Because for full-time vet, they can go seminars, but they cannot choose which seminar they can go. Because this one is sponsored by the owner, right? They cannot choose, okay, if, for example, a full-time vet really like going deep into exotic animals, really like going deep for ortho, they might can ask, hey boss, can I go to this ortho seminar or exotic seminar? But if their boss already going to ortho seminar, why would the boss send you again? They might send you to another seminar. But the promise is only to send you seminar, not the seminar that you like. But for locum vets, you can choose. That's your best bet that you can do now. So save some of your money and then go to the seminar that you like. And that's the only way that you can compete. I'm sorry if I use the word compete, it's very harsh, but this is the reality. You have to, as a locum vet, you have to compete with full-time vet. I'm not saying that locum vet very, very slow in growing, but right now, at nowadays space, you have to really go for the race. So save some of your money, go for seminars that you like, so you can add more value on you. Then at the end of the day, you have more value, your resume is good, you can negotiate your price, and you can earn more money from that. So you are gaining the same thing as full-time vet. Full-time vet have salary increment by year, every single year, or bi-annually. You have your salary increment or your emolument increment by your service. So that's how financial literacy is important for locum vets. Yeah.
Yeah, I think it's interesting that you mentioned that, like, owners who pre-choose the seminars for their vets. I think that's something that, if it's happening right now, it should definitely change, because the vets, they know their own expertise. They should be able to choose, the kind of seminars that they want to attend, the kind of skills that they perhaps want to improve on. So the fact that locum vets, the only thing is that locum vets just need to put aside a certain sum of money to fund going for that seminar. But at least in that way, they have control of going to a seminar or a class that will improve on their current skills, and it just adds up to their own portfolio, you see, rather than it just be learning just for the sake of it.
Yeah, sure. Can I add one more point? For
Yes, of course.
seminars, right? For full-time vets, you cannot go every single seminar in this world, because you have your own job. You have to obey I mean, like,
Correct.
this is a hard word to say, but you have schedule that you have to obey, and then you cannot go
Mhm.
all the time to seminar. But for locum vet, you can. It's just a matter of money. It's just a matter of money. So
Correct.
if you're willing to work hard for the first quarter of the year, for example, because most of the time, the first quarter of the year, there's not much seminars going on. Second quarter, third quarter, yes, there's a lot of seminars. So if you really put your effort on the first quarter of the year to go for seminars that you like, how many times they don't care, because it's your money, it's your locum hard work. So you can go a lot of time. But for full-time vet, they can go, maybe they can choose, hey boss, I want to go to this surgery seminar or x-ray seminar. But okay, then the boss can let you go. But maybe for 1 or 2 times per year. But you
Yes,
can go a lot of time.
because there's also the budget that the clinic has to follow as well.
According to the budget, yeah, exactly.
According to the budget. So maybe like what you said, 1 or 2 times is what they are able to afford sending you to. But unless, I don't know, maybe if you want to go, then you will have to fork out your own money to attend the other seminars. Yeah, but there was something I want to touch on that you mentioned earlier was that locum vets have a big network, because you guys are everywhere, you meet new people, you meet new clients every day. So, what's the difference between the networking opportunities between a locum as well as full time?
Oh, okay, this is a very good one. My friend again, my
Yes.
best friend, he's working a full time vet. He is a very
Okay.
famous doctor, but in his clinic, he has a boss. He in his clinic. So every time client wants him, because he is very good in exotic medicine, every time client wants him, they have to go to his clinic. So what happened to those who are quite far away? They want they want his service because he is very good in exotic. So want it or not, they have to go to his clinic and set an appointment. If he is not available, then he can the client have to go to another doctor. There's no choice. But for locum vets, the beauty of doing locum is you can actually gain not big client base, but wide client base. For example, another friend here in Kuala Lumpur also do locum. The beauty is she is being recognized. She is being requested every single time. So they know her schedule. Everyone, the client know the schedule, the boss know the schedule, so they can say to the client, okay, if you want to see this doctor, you can come on Saturday. So the beauty is every single Saturday, that clinic has a very high turnover rate. So every single time, the clinic around, for example, she is working in Malaysia. For listeners, the biggest city in Malaysia is Kuala Lumpur. So maybe 30 kilometer or 50 kilometer radius, there's another clinic, and this words of mouth is spreading. Okay, this local doctor is very good. You can always hire her. You can always request her because she is very good in doing spay, doing neuter and whatnot. So this type of thing, the client base is not big, but it's wide. So the popularity of locum vet is better than popularity of vet working full time. So you can reach more client by doing locum, but you cannot reach more client if you are in a full time vet, because at the end of the day you are having holidays and then you cannot attend every single client. Be it if there's 100 client that wants you in a full time vet clinic, you cannot attend 100 client. But if you're doing locum, you might you might have the chance to attend 100 client that really wants you. And that is the very important part of being a doctor. People really trust you. People want you to treat their animals. So if you're a full-time vet, yes, you have client base, but you cannot attend everyone. Locum vet, there's possibility you can attend everyone. People know your time, people know your schedule, so they come on that day, they come on that time just for you. That's I'm not calling her a specialist lah, but she is doing a very good job. That's why every single clinic, I think at least 7 or 8 clinic really request her to be a locum vet, even though she is working full
That's
time.
amazing. Yeah.
Yeah. So yeah, I think depends. If you can, I mean, like if you can bear with it, if you can bear going everywhere, traveling. I mean, again, locum you have to travel everywhere, but if you're okay with that and you want to reach more client, not a lot of client, but more wide based client, because Kuala Lumpur is big. So if you are focused maybe on one district, you might not have people around Kuala Lumpur might not know you. But if you do locum around Kuala Lumpur, people might know you.
Understood. And that's a very good point because it actually leads to our next question, is by having a consistent client base. So consistent versus a wide client base, which one do you think, has the better like pros to it?
Consistent client. To be honest, from my heart, consistent client. The one client that trusts you might come to your clinic another 10 times, be it for vaccination, just grooming, cutting nails, or maybe very small injury. They might come to you every single time. The consistency build the first thing, trust. The second thing that comes is money. But if you have wide, you might be popular, but what is your turnover rate? At the end of the day, a clinic hires a locum for a good turnover rate or for a replacement. If you are looking for a replacement, then okay, you don't have to care about turnover rate of the clients. But if you have wide, how come? Because you are not there all the time. For example, if a client needs to clean the wound every single day, maybe the locum doctor do good, but the next day the locum doctor is not there anymore. Another doctor will do it, but the result will not be the same, right? The principle is the same. The theory of cleaning a wound will be the same, but the result will not be the same. So for a consistent client, for one vet in a clinic, in a full-time vet in a clinic, the consistency is very important so that you can build trust. My friend doing exotic all the time. Right now in Malacca, I believe every single people in Malacca always. For our listeners, there's one state in Malaysia called Malacca. Um, every single people in Malacca, I believe, that have exotic pets really look for him. Because why? Consistency. He he gives a very good result all the time. He gives satisfaction to the client, and the client can always rely on him every single day. But on one side, this my girlfriend, girlfriend, the woman doctor, they are she is she is doing good job in making sure that people know her, but there is no consistency. So maybe the client will come maybe one or two times, but not as much as the full time vet that have consistency.
Okay, I think the good thing about having consistency also, because when you build that network of people, I think then you will also have the confidence to be like, okay, I don't need to work under a boss anymore. I can be my own boss. And then from there, it transitions from a full time to like a locum or ad hoc kind of thing. Understood. Okay, interesting. Okay, I think second last question for this episode. Okay, this was a topic that we touched on last year during Singapore Vet Show, and I think we will also be touching on it again this year. It's about burnout. So last year there was a couple of sessions during Singapore Vet Show where we actually talked about mental health, how our vets suffer from burnout because a lot of emotional distress to them when they are treating the animals. How is that something that differs between a locum as well as a full-time vet? Full-time vet.
Full-time vet really I cannot stress this enough. A lot of my colleague, my friends are having burnout. They are burnout means tired is not burnout. Everyone is tired. At the end of the day, you go work, it's tired. But burnout means you are. I'm sorry if I use harsh word throughout this, but the easiest way to say you just don't like your job anymore. That is burnout. You just don't want to do it. It's boring. It's repeating. That is what full-time vet is experiencing. And if you want to know, everyone listeners want to know, suicide rate is also high in veterinarian around the world. It's really high. So it comes from burnout because they are doing repeating things. I mean, I know every single case might be different individually, but you tend to do the same thing every single day: vaccination, spay, castrate, and repeating all over again. FLUTD, FIP, the same thing every single day. So you feel boring, you feel burnt out because there's no variety. You see the same people every single day. You go to the work with the same route. You're eating the same thing from the same restaurant. You cannot escape from that. That's how you become burnt out. And then because burnt out, it nurtures boredness. You feel boring, and then you don't have what is minat in English? You don't have the
Minat
what is minat in English? You don't have the you have the interest. You don't have the interest in your job
Ah,
anymore because you keep repeating the same thing. That is what burnout comes
yeah.
from. So you for full-time vet, you need to have variety. Because why? Locum vets have variety. They are happy.
Correct.
I mean, they work 14 days straight, no problem. Because I'm not seeing the same person every day. Even if I have problem with the first clinic, for example, Monday to Wednesday, I work different clinic. And then Thursday to Sunday, another clinic. And then the next week, different clinic and whatnot. So you are not seeing the same person every day. So you don't have to deal with their problem. You don't have to deal with their behavior. And you don't have to deal with the same client every single day. The variety keeps interest in locum vets going. That's why they can do a lot locums. They have good pay. They don't have to worry about maybe retirement cuts or whatnot. Not that much. They have good pay and they have variety. That is what is the most important. For me, my variety is different. My variety is I work with different animals. I work with poultry. I work with cats, dogs, cattle, and goats. That is my variety. For locum vets, for full-time small animal vets, the variety is not there. It's cats and dogs every single day. Cats and dogs, cats and dogs. But the variety that you can imply is by being locum is different workplace environment. So if, for example, like I say, for Monday to Wednesday, you work in clinic A and you don't like the environment, what is your what is your what hold you back from leaving that clinic? There's nothing, because you don't have responsibility. There's no contract. It's a locum doctor. Maybe if permanent locum, yes, you have contract. But if you don't like clinic A, you can just go. There's no problem. There's a lot of clinics. There's thousands of clinics in your country. So variety is there for locum vets. So burnout more on full-time veterinarians. So how to deal with this burnout? You are willing to sacrifice. That's the best. That's the best thing I could say, is willing to sacrifice. If you want more money, then you have to deal with burnout, and you have to deal with burnout every single day. So what will you do at night after you finish your shift? Are you going to stare in your phones? Are you going to the gym? Are you going to deal with the family and whatnot? That's maybe workplace problem, not including the home problem. Let's not talk about that. That's a different problem. Only workplace problem you have to deal every single day. It's the same thing. It's repeating and it is boring. Locum vets, no problem. I see different people every day. I might not have the good stability, but I have flexibility and I have mind stability because I don't deal with burnout. I do 14 days straight work. Another 14 days, I go jalan-jalan. I go Singapore, I go Gelang, I go everywhere, I go see Taylor Swift and whatnot, because I don't have any responsibility. I don't have contract in this clinic, but I'm still earning good money. For full-time vets, you need to find your way how to deal with burnout, because definitely you will have burnout. My friend, that's why I say, coming back to my friends, my best friend, he is dealing with burnout very good. He's going to, people say you are going to the gym, you put more stress on your body, but you don't know that's the only escape that he can have. Locum vets can escape every single time. If they make mistakes, if they make bad things in locum clinic, for example, people tend to make mistakes, right? To correct that problem is one thing. Nothing you can escape. But for full-time vets, you cannot escape. You have to face that mistake and you have to correct that mistake. And it costs you mental stability to do that, to correct the mistakes, and then being scolded by client and whatnot. So for full-time vets, please work out on how to deal with your burnout syndrome. For locum vets, if you are burnout, I'm not sure what to say because you have that variety. I don't know why you
You
still have
shouldn't be
burnout.
burnt out.
Yeah. So yeah, that's it. Burnout is definitely, I mean, 100% guarantee in a full-time veterinarian that working in clinic, and you cannot deny this. You cannot deny this.
Because there's always the attachment to that clinic that you're working for. You're always seeing the same pet, you're seeing the same dog. Like there's nothing new for you to explore. So when life gets so mundane and boring, you're like, what do I do now? And then that's when the burnout starts kicking in. And then with the long working hours, and with the same repetitive things, working under a boss, if your boss not understanding, then that's something else that can cause that burnout as well. So I think then that's where the pros of being a local vet comes in.
Yeah. Again, I just want to add one more point. Along the
Yeah,
way, you have to, develop your career. So if you have
of course.
burnout, this burnout thing will have a very rippling effect. For example, I give one example. A burnout vet is basically a senior vet, someone who has been practicing 5 or 7 years. You know what they do? They tend to let go some of their job to this junior vet. And then because junior vet is very eager to do things, they want to do this, they want to do that. That's why they give, but not in a sense of teaching the junior. So if this junior is seeing, okay, my senior after 5 or 7 years, they are going mundane, they are going boring, they are not doing anything. That is not what mindset that I want to that we want to have in vet industry. You cannot do that because junior are looking out for the seniors. If you are a senior, you need to have that interest, even though you are a pro. For example, if you are a pro and you have been practicing for a long time, your interest must be there. You cannot deal with burnout all the time. You can burn out. We are normal people. We have burnt out every single time, but it cannot be there all the time. So you have to deal with it because why? You are setting example for the junior. Junior are eager to do everything, but seeing the senior very mundane, letting go jobs, letting go all the cases to juniors. Then what picture are you showing to the juniors? Then we have
Yeah,
you will have a bad picture. But you are a senior.
correct.
So again, all vets at the end of the day, you will be senior. Maybe right now you are junior,
Yeah.
but you will be senior, and you need to set a good example to your junior.
Yeah. I think when if a senior vet were to ever do that, then the junior vet will be, oh my god, is this going to be me in 7 years time? And they're coming in with so much passion, and then they see that happening, and then when that passion fizzles out, then that's the sad part. Yeah. So which like what you said, burnout is something that every human being goes through, and it's something that we need to learn how to handle it. Find something that piques your interest, something that you really enjoy. Use that as your source to, like, release your stress. Go out networking with your friends, even a nice dinner to treat yourself once in a while. Yes. Last question, because we told ourselves 30 minutes, but we are more than 30 minutes, but it's fine. So, based on what we've discussed about locum and full-time vets, job availability, do you foresee people going more towards being a locum or full-time? Full-time.
It depends on place. For example, if Singapore is doing locum, definitely it will be full vacant all the time because there's not many vets in Singapore, but there's not many.
Yeah.
There's a lot of clinic in Singapore, but there's not many vets. Some vets go to holiday, off day, and whatnot. So it depends. If Singapore, I think the locum will be very popular. For me in Malaysia, as far as it goes in Malaysian veterinary locum community, what can I see the trend? If the clinic locum availability in Klang Valley, it is very hot, very famous, always not available. One time, in the morning post, there's one post locum vacancy in the morning. In the evening, they already find locum. But for example, in southern part or northern part of Malaysia, rarely they opt for locum. They need locum, but because going to southern part or northern part of Malaysia is quite far, so they have to consider travel and also lodging and whatnot. For me, the locum is uptrending. The locum is uptrending, but again, we are lacking of that. Be it maybe in Southeast Asia, I'm not sure. I can see it in Malaysia, I can see it in Singapore, I can see it even in Indonesia, we are lacking of vets. So locum is an uptrending thing. Um, it is not only because of lacking of vets, but vets that are eager to find money. For example, in medical doctor, my dad is a doctor, and he is well known for a very hardworking doctor who do locum all the time because he cannot sit still, and he just want to find that skill, and he wants to help his family. That's it. So locum, the blessings of having locum in Malaysia is if you need extra money, you don't have to do things out of veterinary field. That's why it's being uptrend. Because people before this,
Understood.
you are a vet, you are not being paid good. You are not being paid good. There's not enough money for you. Along the years, inflation, your loans and whatnot, you have to pay. So another thing is not many vets end up like me, can do content, can speak with people, can promote things. There's not many vets like this. So where do they go? They do locum. It's not out of their field. It is still in their skill set, and they can earn good money. That's what good being a locum. So for me in the future, especially in Southeast Asia, yes, locum is uptrending, but it will not kill. It will not kill full time vet. Why? Because this locum thing create what we call pertandingan, create competition between locum vet and full vets. Because for example, if you are a locum vet, and then I am a full time
Yeah.
vet, right? I do my job. I think I am right. I think I am the champion in the clinic. But suddenly you become a locum vet in my clinic. I feel enraged because you are better than me. So I have to do something because I know there's another good vet that is coming to this clinic and do good locum and have good name. But me, I'm working as a full-time vet. I have no name. Even though I feel like I am champion, I feel even if I feel like I'm doing good job, but because there's no competition, I stay at the same place. But if locum vet come, then it creates competition, and vet will become better in the future.
Okay, understood. And I think it also boils down to generational differences. I feel like the current generation, they want more flexibility in their working like career path. So locum may seem more enticing to them as compared to full time, where 9 to 7, I need to listen to someone, and it's going to be the same thing. So locum may seem like the better option for them. But then maybe for the older generation, they prefer full time, because it's very set, it's very it's confirmed that this is what you get at the end of the day, your salary. So that stability is what they're looking for, whereas I think the new generation looks for more adventure, I would say. Yep. Yep. So I think that's all the time we have in this episode. Like, for everyone listening, I hope that this podcast was able to help you understand the difference between locum and full time vet career. But of course, ultimately, I think we both agree that the choice boils down to the vet himself or herself. Whichever works the best for you, please make the decision that best fits your lifestyle. So, Dr. Ilyas, before we go, any final thoughts or statements regarding our topic today?
There is no wrong or right. You can be full-time locum, you can be full-time vet, you can be full-time vet and also full-time locum, no problem. It's again, Fira said, boils down to your choice. You know what you want in your life. Just one thing that I want to say, please keep this comfortability in veterinary field, because at least you feel challenged between vet and vets, not vets and another few people not vets. Because right now, non-vets is much, much better than us. I work in the poultry industry. The manager is better than me. The senior manager, the supervisor is better than me. So that makes competition. That what makes me feel want to do better. But for small animal vets, you have to know those breeders, those pet groomers, those who own pet shop, they might become better than you. So this locum thing, this veterinary field that have locum, at least keep the competition between vets and vets. At least you know you have to become better, and there is someone better than you. That is how we keep this veterinary field living. There's no wrong or right. You can be locum full time. I manage locum group. They are doing very well. They are paid. They are paid as for now. Okay, not that well, but okay. If you are full time, I full pledge for that. You can have a lot of stability. Again, it's your choice. Make a good choice, no problem. Don't be afraid of failing.
Right, thank you so much, Dr. Ilyas, and thank you to everyone who has been listening in so far. So keep a lookout for the next episode, and we will see you very, very soon.
Thank you so much. Bye bye.
Thank you.